Hello. Thank you for joining us this evening for our virtual Healthy Minds, Healthy Bodies seminar. As a reminder, all lines will be muted. The presentation will also be recorded and provided via a follow-up email. We want to cover some quick rules of engagement as it relates to the virtual seminar today. The presentation is being recorded, and a link to the recording will be provided in a follow-up email. Please use the meeting chat feature to ask questions or make comments at any time, as they will be addressed at the end. During the Q&A portion of the seminar, you may raise your hand. I'm sorry, that's not right. Please ignore that last comment. Just bear with us as we might encounter any technical issues this evening. It is now my pleasure to introduce you to your presenter, Dr. Sandeep Jalli with the Samaritan Cardiology in Corvallis. He will be talking with you today about the cardiovascular benefits of exercise and the role popular devices like Fitbit, Apple Watch, and others can play in our exercise routine. So with that, I will hand it over to Dr. Jalli.
Thank you so much. I'll move past this picture. Just a little bit about me. I came to Oregon from Georgia, and I'd like to thank Dr. Early and Dr. Harkness for helping me create this presentation. Before we get started a little bit, I think one of my aims or our aims was not to focus so much on what specific exercise might be beneficial, but just sort of the benefits of exercise in general. And then since most cardiologists seem to be techies, to talk a little bit about fitness tech and some of the wearables that are out there. Looking at the CDC recommendations for how much exercise we should all be getting, they recommend that we all get at least 150 minutes a week of moderate intensity aerobic activity. And they actually have a pretty lax definition of what counts as moderate intensity. And that's pretty much anything that gets your heart beating faster. And that's including things you might do during your daily life. They also recommend that we do muscle strengthening activities 2 days a week. And those are just things that make your muscles work harder than usual. They have some helpful pictograms to sort of identify activities we might do. Obviously, things are a little bit harder during the current pandemic and with social distancing. But outdoor activities are still available for all of us. So I wish the guidelines were just that simple, but they do sort of break it up a little bit more and make it a bit more granular for people that may want to do some more vigorous intensity things. So if, for example, in example 2, you didn't want to do just moderate activity things 5 days a week, you could go jogging or running for 75 minutes or every week. And then still add the 2 days a week of muscle strengthening activities that work on all your big muscle groups, like the legs, hips, back, abdomen, and chest. Or you can sort of mix it up a little bit more, like here in example 3, and add both an equivalent amount. So 30 minutes of moderate activity, 30 minutes of vigorous activity, 2 or more days a week, still keeping the muscle strengthening things. One of the questions that sort of pops up here is, how do I know how intense, quote unquote, my exercise is? I think the easiest thing, and one of the most interesting things they say in this guideline document, is that the talk test sort of tells you how hard your exercise is. So if you're able to talk, but you don't think you want to sing, which I'm not typically a singer when I exercise, but in any case, if you could talk but not sing, you're probably doing moderate intensity exercise. Whereas if you're not able to talk at all without losing your breath during the exercise, that's probably vigorous or high intensity exercise. They give some examples of what might count in both of those categories: walking 3 miles an hour or faster, ballroom dancing, gardening, or tennis. They specifically mentioned tennis doubles versus singles, moderate versus vigorous intensity. And then swimming laps, hiking uphill, or bicycling are all examples of vigorous or high intensity exercise. This isn't an exhaustive list. There's certainly multiple things we could do. Again, our goal here is just to sort of raise our heart rate and make ourselves feel a little bit exerted. So, you know, we have these recommendations, and they've been out there for a while. Certainly, anyone that's gone through any sort of high school or college fitness program will be familiar with those. But one of the things I think we need to think about is how much do we actually get as a society, and what have all the efforts over the last decade or so to increase our activity level actually done. So there's a big survey that the CDC mails out to thousands of households. It's called the National Health Interview Survey. And what they saw is that on average, only 24% of adults were getting enough physical activity. This is obviously pre-pandemic. You know, it may be an interesting area of study to see where things are sort of during the pandemic and post-pandemic, but you know, people tend to be more physically active in urban areas, but only 19% of people were getting quote unquote enough versus 13% in rural areas. There was a bit of an increase, so we got up to 25% in urban areas versus 20% in rural areas. But again, these numbers are, you know, you certainly wouldn't pass a test with any of those numbers. So, you know, one of the questions that I always get, or that is commonly comes from patients is, well, I go to the gym and I see this sign, and actually I found both of these images by just Googling gym rule signs. But the sign always says, consult a physician before beginning an exercise program. And this one actually says the exact same thing. Also adds, use equipment at your own risk. You know, one of the questions becomes, who should actually see their physician before they start an exercise program? There are recommendations that come from the American College of Sports Medicine about who should be screened by a physician before starting one of these things. I don't think any of us would ever really say to our patients that you shouldn't exercise, except in a few rare circumstances, but we may want to do additional testing or do some activity modification before a patient starts exercise. So in this document, or in these recommendations for screening, they actually have this sort of interesting chart here. So in this chart, they have both an active and a sedentary person. And they just looked at how often the active person was exercising versus a sedentary person. And then what if you suddenly put these people on sort of an exercise routine? So the active person, especially if they're exercising 5 or more days a week, has a much smaller risk of acute myocardial infarction or heart attack versus a sedentary subject who has a risk up here in sort of this 100 level versus the risk is down here at 2. The scale is unfortunately a little bit deceiving here, but I think the difference is still pretty evident. But of course hasn't really answered the question of who should speak to their doctor. So again, if you already participate in regular exercise, unless you have, you know, known heart disease or bad kidney disease, you're pretty much safe to exercise, especially if you're asymptomatic, not having active chest pain or symptoms that would concern you in any way. On the other hand, if you don't exercise, if you have no disease and no symptoms, of course, you probably don't need to see a doctor. If you do have heart disease or kidney disease, but you don't have symptoms, you probably still should see a doctor. And then, you know, if you're having signs and symptoms, but maybe have not been diagnosed or you haven't seen someone in a while, you should definitely see a doctor then. Getting to sort of the meat of this talk, you know, one of the things we think about when we measure exercise is not only that sort of breathlessness test, but sometimes people want a more objective measure. So heart rate monitors can certainly provide that. You know, if you're looking at any heart rate monitor, you can calculate your quote unquote maximum heart rate, which is 220 minus your age, according to the American Heart Association. And there's a sort of range of ages here and max and target heart rates. So a moderate intensity exercise level would typically be between 50 to 70% of your maximum heart rate, according to the AHA. So for someone that was 60 years old, their max heart rate, quote unquote, would be 160. And your target heart rate would be 80 to 136. And when we say target, I wouldn't fixate necessarily on those numbers, but just use them as sort of a guide to make sure that, you know, if you are exerting yourself, you can really prove that you are by having your heart rate rise appropriately during exertion. So, you know, why is exercise important? We've gone a bit through, you know, all the recommendations and what they are, but why exactly should we exercise? Other than that, I think we all at some level know instinctively that it's good to be active. This is an interesting graph from The Economist. You know, the data here is sort of old, but I think was some of the most recently available. So this is health spending versus life expectancy for sort of major developed countries. And they're comparing sort of apples to apples, people in Japan, England, Canada, Germany, Switzerland, and the United States. And if you look, you know, our life expectancy has sort of plateaued here ever since around the 2000. Whereas other nations, we all started off right at around the same place in 1980 of sort of going up in this other direction. There's another piece here on the x-axis, which is health spending. I'll stay away from discussing that right now because it's a bit outside the realm of this talk. But certainly, you know, exercise does not cost a lot of money. So, you know, there's an interesting hypothesis out there of whether, you know, spending more money is the right thing, or maybe if we changed our behaviors a little bit, we could really tilt this graph back up in the other direction. This is another graph that sort of goes up in the same direction, but the directions here are worse. So this is a national health survey sent out by all of the public health authorities in these countries. And they looked at who is quote unquote obese, whereas obesity is defined as having a body mass index of greater than 30. So, you know, the data for this one unfortunately ends a little early in 2015. But just looking at things, you can see in the United States, again, we see in 1980, around to the mid 80s, we're all sort of in the same place. And then somewhere in the mid 90s, we sort of started to take off at this linear rate. I will note that we sort of started off at maybe a higher level than other people too, with 15 to 20% of people being obese at baseline, and that's sort of rising into 30 and 40 percentile numbers. If you look at obesity by state, you know, I think this color-coded thing can be a little misleading. This is a picture that's out there a lot. This also comes from CDC data, and this is just a percentage of people, and this is actually self-reported. So they just sent out a questionnaire to people, and they thought, do you think you're obese? And they sent it back. So, you know, in the West Coast states here, Oregon, California, Washington, you'd think we're doing pretty good compared to, you know, my home state of Georgia here, and places in the deep South and Midwest that are in the red. But I think the differences are all actually not that great. You know, we're still at 25 to 30% of people self-report that they're obese in all of these yellow states, versus, you know, maybe 10% more in some of these darker orange, darker red states. So how do you lose extra pounds? I think there's sort of two sort of ways to do this. One is to eat food, not too much. And then the other one is to increase physical activity. One of the questions there, maybe somewhat of a not obvious question, is if you increase physical activity, what happens to all the weight? So, you know, another way of posing the question is, when someone loses weight, where does the fat go? They actually did a survey of 50 of each of these people, 50 family doctors, 50 dietitians, and 50 personal trainers. And they asked them what happened to the fat. So, as you can see here, around 60 to 70% of these people thought that it was burned away as energy or heat. Some of them thought that they weren't really clear what happened to it. Some of them thought that it became muscle. Some people thought you sweated it out. And then there's a small minority here, interestingly, all dietitians, who were correct, and that it turns into carbon dioxide plus a little bit of water. The mechanism there, I think, is lost somewhere in my chemistry classes, but in any case, you essentially, burn fat and exhale it in this convenient animation as CO2 plus some water. So this is just another way of sort of illustrating the same thing. If you have 10 kilograms, about 22 pounds of fat, triglyceride, more scientifically, if you burn that away with oxygen, 8.4 kilograms, so about 85% of that gets exhaled as CO2, and then around 1.6 kilograms, so 10-15% becomes H2O, water. That I think is just sort of an interesting statistic, or interesting way of looking at things as we exercise and talk about exercising. So, we've talked about why we should exercise, or what the statistics are and what the current situation is. We know what the recommendations are, but what sort of is the evidence behind exercise, or how can it help us? And this is just a study that was done that shows on the left axis here is mortality, and then on the right axis here is how much physical activity you're getting in a week. They used a statistic here called MET hours per week, which is not really necessary to understand the point of this graph. If you exercise none at all, you get no benefit from exercise, which makes complete sense. But as you start adding sort of even minimal to moderate episodes of exercise, you can see you have a really steep fall off on this slope, and lower numbers are better here. So whereas you had 100%, here you'd be at about an 80% ratio. So almost 20% less chance of mortality, whereas you're working only, 2.5 hours a week. And then obviously, as you increase that, that sort of comes down, but not at that really steep slope. And then, there also, there was this thought many years ago, and it's still sort of floating around out there, that, as you increase the amount of physical activity you do, you sort of are at increased risk of mortality. And that turns out to not really be the case either. I can't say you maybe are not at increased risk of injury or something like that, but not really at increased risk of mortality. And again, here we're at that same 150 to 300 minutes of moderate physical activity. And they do highlight that you achieve about 70% of your benefit by getting around 8 hours a week, or 8 MET hours a week. Again, the specific numbers are not super important in understanding the point that's being made by this graph. This is another large sort of study of studies, and what these authors have done is that they've sort of integrated lots of studies with hundreds and sometimes thousands of individuals. And these were people in sort of two categories: people that had low cardiorespiratory fitness and people that had high cardiorespiratory fitness. And then they just sort of followed them and see how many of them had cardiovascular events or died actually during this period. I think these graphs are probably the easiest way to examine this. And basically, it's sort of self-explanatory. If your sort of black bars are over here in the favors high cardiorespiratory fitness side, that means that people that had high cardiorespiratory fitness had less events and less deaths. Some of these studies sort of date back to the 1980s, and some are quite new, 2008, 2002, 2004. So just sort of more fuel for the argument that, exercise makes you live longer. And as we saw in the last graph, maybe it doesn't even take a whole lot of exercise for you to see that benefit. Does that mean that you should sort of do a moderate amount and then stop if you're capable of doing more? No, probably not. But I think it does provide encouragement that whatever you can do, whatever effort you can make, you will see some benefit from that, even if it's not immediately obvious. This again is a similar sort of graph, and I think this comes from the Journal of the American College of Cardiology. In this case, they looked at people that are runners, and they called it sort of, quote, leisure time running. And all these people, you know, whether you're running sort of less than 50 minutes a week, less than 6 miles a week, running only once a week, running, you know, fairly slow, less than 6 miles an hour, so less than about a 10-minute mile, you can see that your ratio of cardiovascular mortality sort of drops off really quickly. So again, just a little bit of effort can lead to some pretty dramatic improvements in cardiovascular mortality. There is a whole other risk of health benefits. I won't go through and show you all these other boring graphs, fortunately, I think. There's a lower risk of all-cause mortality, cardiovascular disease mortality, lower risk of stroke, hypertension, type 2 diabetes, lower risk of having an adverse cholesterol profile, a lower risk of cancer, interestingly, improved cognition, reduced risk of dementia, improved quality of life, reduced risk of depression, more sleep, sort of obviously slow to reduced weight gain, weight loss, but only when combined with reduced calorie intake, and then prevention of weight regain following initial weight loss. Bone health, you know, our bones are sort of one of those things that interestingly need a little bit of stress to grow stronger. Improved physical function, and then lower risk of falls, which is something that's really important in older adults. So now we're sort of getting to the, to me, interesting part of this talk. You know, there's lots of technologies out there that can help us with exercise. There's sort of the more basic thing that we've all seen. It's on every machine at any gym you go to, which is a heart rate monitor. Personally, I hate the ones on the machine at the gym. There are accelerometers and pedometers. So just sort of defining these two things. So a pedometer is something that just counts steps. An accelerometer is a bit of a more sophisticated device that has an actual accelerometer in it, and it can count more body movements. There are fitness apps that have maybe none of these things that may work with the accelerometer in your phone. There are web-based exercise programs, and all of these can really help you monitor yourself, so there's a true objective measure of what you've done in the day, the week, the month, etc. You know, depending on if you want that or not, of course. Heart rate monitors, like I said, are sort of the most basic thing. They really can help us estimate how much energy we're using. All these numbers and percentages sort of vary based on what source you're looking at. But I think, again, if you're getting to between 60 to 80% of your maximum heart rate, as we previously defined it, you're in the higher end, you're in that moderate to vigorous zone, which is where you would want to be. And we just have, again, a table here of ages and then what your heart rate would be at low, moderate, and aerobic, vigorous, or maximum intensity zone. And, you know, maximum intensity doesn't mean your heart rate can never go over that. You know, I know my heart rate sometimes is above my maximum heart rate if I've had a bit too much caffeine before working out, but it's just something you don't want to see all the time. You know, another way to think about heart rate is resting heart rate. And that's a sort of very interesting thing to think about. What I'm going to show you here is a study of studies, again, a sort of compilation of 13 studies in the English-speaking literature involving exercise in people that are greater than 60 years old. So all these authors, and again, these are large studies that start all the way from 1991 to 2001. But again, you can see is if your black dots are sort of on the left side of this line, it sort of favors exercise as reducing your resting heart rate versus control as a multiple of other interventions they tried or sometimes nothing at all. And that obviously begs the question of why is the resting heart rate important? You know, if you sort of Google around or look on more medical search engines, you can find resting heart rate correlated with almost anything. or elevated resting heart rate. This was a long 16-year study done in Copenhagen, and they followed a group of adult males. And what they saw is that as your resting heart rate decreases, you are more physically fit and you are less likely to die. There is similar data for, interestingly, resting heart rate and colorectal cancer. You know, what the physiological manifestation there is, I have no idea. Again, this is just sort of the same thing, more data from that study. As you can see, as your heart rate increases, you have a greater incidence of mortality. And as the number drops down, you know, as your heart rate drops down, your mortality goes down as well. And there are some other sort of more objective things in the rest of the table. Fitness apps, like we already talked about, are a great thing. They can really help with goal setting, with giving you feedback. Some of them are sort of more interactive than others, and they can talk you through if you're having trouble with exercising, or maybe you need to schedule your exercise at another time. Some of the web-based programs are also great. You know, going back to the apps, some of them allow you to input how much you're eating every day, so you're able to keep track of that as well. Some of the web-based programs help you with a variety of workouts, provide information about improving exercise as well. So getting to the gizmos, I'm kind of ashamed to say I don't even know what some of these things are here. I think these are both Fitbits. This is just a heart rate monitor. This may be one of the Garmin devices, and I believe these are headphones. So, you know, one of the obvious things that always gets asked is, you know, if I buy one of these, is it actually accurate? And I think some of this sort of depends on what exactly you mean. If you're looking at just counting steps, most of these are fairly accurate. You know, this is a study that was published in the Journal of the American Medical Association in 2015. And they looked at a variety of Fitbit devices, a Nike device, iPhones, a Samsung Galaxy phone, and the app included with it, and saw they asked people to walk 500 steps on a sort of measured track. And then they compared that to how many steps the device counted. And, you know, all of them are fairly reasonably accurate. If you look at other studies, some of them perform worse if you're on a treadmill or going up hills, but again, still within a realm of reasonableness. Whether they're accurate or not, I think the real question is whether they work and help people. And there's multiple studies in the literature saying that they probably do. I won't take you through the sort of nitty-gritty of both of these, but one of these was published very recently in 2020, and that's, I believe, this one. And in this study, they took a group of women, they gave them Fitbits and the accompanying app, and actually saw which group of women, the with Fitbit or without Fitbit, was more physically active and lost more weight. And the with Fitbit group did better. And then similarly in this other study here of weight loss in overweight adults, you know, there have actually been similar studies in adults that get discharged from hospitals. If you give people one of these physical activity devices when you leave a hospital, people tend to be more active. And, you know, one of the things we ask all of our patients, within reason, of course, is to be as active as they can after they leave the hospital. Going back to accelerometers and pedometers for a little bit, you know, if you look at studies, using a pedometer increases the number of steps taken per day. There are around 2,000 steps in a mile. I think this is for the average adult. You know, some of this varies according to your stride length, etc. There are around doing around 8,000 to 9,000 steps at a rate of 100 steps per minute is equivalent to 30 minutes of moderate activity. And then for weight loss, 11,000 to 13,000 steps is recommended. I'll often hear patients or just folks in the community say that they should be doing 10,000 steps. Just as sort of a historical aside, as part of my research for this talk, it seems like that sort of 10,000 step goal came from a fitness program put on by the Japanese government actually in the 1960s. And I can't say what evidence it was based on then, but if you think back to some of the graphs we looked at earlier in this talk, it certainly seems that the Japanese were fitter as a society than we were. So it seems to have worked. Heart rate monitoring devices and activity monitoring devices aside, there's this other category of things, particularly in the cardiology world, that our patients ask us about. There's the Apple Watch here, and then there's this Cardia sort of EKG attachment for multiple types of phones. And both of these are, the title of the slide is rhythm monitoring devices, but I sort of would say that that's a bit misleading. They're not really rhythm monitoring, but really sort of rhythm check-in devices. They all come with sort of a lot of disclaimers. You'll notice here on the front side of the Apple Watch, it says that it never checks for heart attacks, and that's quite true. There are pros and cons to sort of all of these things. Pros include that it puts a lot of data in the hand of the consumer. You can track and monitor your progress. As a physician, for some of these things, there's a more formal way of looking at the data. For some of them, there is not. But it can help us to, improve how we make decisions. Cons are that we can get a lot of data that isn't super useful. And, there are some sort of data security issues and privacy concerns. Here at Samaritan, we're fortunate that patients can upload some of their tracings to the MyChart system, but in another health system, you may be emailing them to your doctor or printing them out and taking them with you. There's actually a very interesting website out there by a gentleman called the Skeptical Cardiologist, who's skeptical of most things. I've provided a picture here, and he has this entire article about do mobile heart monitoring devices work? And it seems like they're pretty good at some things. The Apple Watch in particular has been studied at detecting or spotting atrial fibrillation, which is one of the most common arrhythmias in folks as they age. If you Google around for evidence, you'll find these sort of breathless articles. I think this one is from ABC News, and it says, Apple Watch told a 46-year-old man he had an irregular heartbeat. It was right, and it potentially saved his life. And same thing, I think this was a blog of some kind. This gentleman says, I resisted the Apple Watch for 5 generations, found my Afib the first 5 minutes it was strapped on, and probably saved my life. Can I actually say that the Apple Watch saved the life of these folks? No, but I think it probably helped get them an earlier diagnosis. All that aside, sort of interesting to think about, there's not, I think, outside of our cardiology office, probably a lot of people that really want to keep track of their heart rhythm day to day. People are more likely to want to measure blood pressure, and that's very hard to do from sort of a wrist-based device. And then a lot of people would like to keep an eye on just how their heart is doing health-wise. That also is very hard to do. There are some wearables coming out there to monitor blood sugar levels. Those are sort of more invasive and designed for the diabetic population. We're at sort of the end of the talk. These are the resources we used. And then every slide I used, I tried to provide you with the title of the study, the authors. So it is readily available and can be Googled for most of these things. For some of them, you may not be able to get the actual data, but you'll at least get the abstract and be able to search back through. Most of the data on exercise recommendations comes from the CDC, and they have a very helpful page on exercise. and even exercise during the pandemic in a time of social distancing, which may be useful to look at. I think we can turn to the Q&A now.
All right, great. Thanks, Dr. Jalli. We have one question here that says, it's from Faye. It says, I started using a heart rate monitor on an Apple Watch for the first time ever. I'm 63 and have jogged for decades and always used the talk test. With the monitor, it jumps to 150 to 160 while I'm jogging, but still able to talk. When I stop, it drops down to 110 or less very quickly. I can't seem to find the pace that feels like exercise and stay in my target range. Do these devices need to be calibrated?
You know, I don't think that they need to be calibrated. Most of them use a sort of a light-based sensor to check your pulse. I do find that my Apple Watch is sometimes not the most accurate when it doesn't fit well. So that may be something to look at. I don't know if you have any other thoughts.
Yeah, I agree with you that there can be, some issues with detection depending on the fit, certainly. And then the other thing I think you'd mentioned during the talk itself was that, the heart rate can jump up, but the sustained level of heart rate would be the one that would be more you'd use for kind of finding your target heart rate. That being said, it isn't everything in the ability to exercise, and kind of how you feel, I think it can play a more significant role. All right, we've got another question here, Dr. Jalli. I think is a good one. It says, what are some good ways to get enough exercise when we do not go to the gym? Probably referring to the pandemic and gyms being closed down.
Yeah, I think I've found this to be a personal struggle for me too. Schedule permitting, outside is always a great idea. I think we're really blessed here in Corvallis and in Oregon in general to have some really great places to walk and hike, weather permitting, of course. The CDC on their website, they have some suggested sort of not exercise routines, but exercise in general. I'm not endorsing any sort of specific type of exercise or a specific exercise routine, but I found YouTube to be a great place as well, to find little exercise routines that I can do at home with no equipment. Obviously, I think you would need to be a little bit careful to look at your own individual fitness level. It's probably not a great idea to pick like the expert level CrossFit class as your first YouTube at home fitness thing, but those are all out there. There's the very popular and highly advertised home fitness device, like home gyms. There's the one that looks like the mirror. There's all the bicycles, etc. So those are all things out there. Obviously, I think all of us wish that the gyms were open, or at least I certainly do, because that it's a big part, or was a big part of my routine, and that just keeps you going back.
Another question says, is stair climbing and descending good to do on rainy days?
Yeah, I think stairs are a great workout. I would say if you're doing stairs constantly, to give yourself a little bit of a break too. It can be a little taxing on your knees, and make sure you have good shoes, etc. But stairs are great.
All right, another question from Mackenzie that says, what do you think about wearables that measure oxygen levels in the blood? I think some new products do that these days. What does that measure tell you about your health?
You know, that is sort of, I think, an interesting piece of data, but I'm not sure how valid it is. You know, most of these are using the same technology as the little finger probes we use to tell you how much oxygen is, you know, theoretically saturated in your venous blood. They could certainly be useful for people with lung conditions, etc., so they can monitor, you know, their oxygen levels as they exercise. There are some sort of more invasive, or, you know, we do measure oxygen occasionally as a measure of what your sort of peak exercise potential is, but that's done in a much more formal setting in one of our exercise labs sometimes. So I'm not sure any of these wearables really reach that. On the other hand, it's not really something I know much about. So Tyler, do you know, have you seen?
Yeah, I agree with your evaluation. I think this is really just and I don't know actually the data on how comparable these new oxygen level monitoring systems are to the, you know, medical grade oximeters. I think from what I understand, they're pretty good, but I don't know if they even measure up to that medical grade level. I know certainly from the FDA's view, they're not to be used in that view. However, I agree with your statement, Dr. Jalli, that the way that we utilize the data for exercise specifically is much more comprehensive in an exercise lab for evaluation of, you know, your fitness with VO2 max and those other kind of measures. Another question that just came up here, which I don't know that I know the answer to, but says, are the sleep monitoring functions on these devices very accurate?
You know, that's sort of an interesting question. I don't know how accurate they are, quote unquote, or how precise they are. But I do think that if they tell you that your sleep is disturbed or that you don't sleep well, you should probably talk to your family physician about that. You know, one of the most under-recognized problems or diseases in America is sleep apnea, and I certainly think as the prevalence of obesity increases, it increases as well. So if you think you have problems with your sleep, a more formal sleep study may be a good idea.
Okay, another question here says, what is the best exercise to work on lessening visceral fat around organs?
You know, that's sort of controversial kind of thing. The data is good that doing a long-term study on exercise and weight loss is a bit hard because it's hard to get people to consistently exercise and lose weight over a long period of time. Aerobic exercise is great, I think, at weight loss, just sort of general terms. As far as specific exercises, probably not the best person to answer that question.
Okay, do we have any other questions before we wrap up for tonight? We do thank you again for joining us. Your feedback is valued. If you could please take a moment to complete the brief survey, which I will place in the chat area, and then you can watch for the follow-up email, which will include the link to the recording. Thank you so much and have a wonderful evening.